Good evening, everyone, and a welcome to this session on the Quality Improvement Framework for the Early Learning Childcare sectors. I should say that if you've joined any of our recent engagement sessions, you may have heard some similar content. However, we're delighted that you've chosen to invite us and to join you tonight. Stakeholder engagement has been a real key feature throughout the development of this quality improvement framework, and we've really valued all the participation and engagement in our webinars and our face-to-face events, and we'd like to thank you all for your engagement up until now, and then again for the number of you that have joined us tonight. Thank you. But as we developed the framework, we were asked to consider a number of priorities, including reducing the duplication. We were asked to create sector-specific content, and for many of you on the call tonight, that will be something that you were absolutely, clear about, that when we started again to look at the framework, that you wanted that sector-specific content for your unique role that you play. We were asked to ensure that there was consistency of language and terminology. And for example, in How Good is Our Early Learning Childcare, we talk about practitioners, and in the quality framework, we talk about staff. And we were also asked to reduce the length of the framework. And we were asked finally to include challenge questions. So we're all absolutely delighted that we've managed to streamline the number of quality indicators from 28 down to 11. And when we first went out on some of our consultation events, we were asked, we asked the sector some blue sky thinking, and some people suggested 10 quality indicators. So we're delighted that we have actually reduced it to 11, and that's 10 quality indicators that each organisation have 5 each, and then we have one that's shared between both of us. We've reduced the duplication of content where possible, and we've worked hard as two organisations to do that. But I suppose most importantly, we've managed to provide sector-specific content and quality indicators specifically for childminders and the school-aged childcare sector. And we'd like to thank SCMA, who worked alongside us as we created that sector-specific content for yourselves. We have created a digital framework, which is interactive, but we recognise that for some people, they would still like to print a copy of the framework. And this will be downloadable. But what we would say is, if you can, please wait until September, because as we've gone through the framework since it's been released in January, we've had several engagement events, we've had a pilot, and from all of these events and from the pilot, there are going to be some changes made to the framework. We don't expect huge changes, but we do expect there will be some slight changes to terminology, or there might be additional information just added for clarity. So we would ask that you don't download it at this moment in time. What will happen is in nearer September, when we are confident that we have taken on board all of the changes that we want to make, we will then let everyone know that the next version, so the version that's currently on our site, we are calling version 1. So version 2 will be the next available version. And we'll make sure that as we develop the framework, that we continue to update the version control, so that if you have printed one, that you've got version 1, then you know that the changes that we're making will be in version 2. So we have added the challenge questions, and we've taken on board feedback to ensure that these were accessible in a consistent place. And some of the feedback that we've had from our pilot is that our challenge questions are too long. People feel that there are certain questions that are too long and maybe need a bit more clarity. So it's kind of things like that we will be making changes to. So please don't download it at this moment in time. Kelly, do you want to move on, please?
Yeah.
Thank you. So the aims of the session tonight is we are going to provide you with a framework update. We're going to explore the framework in a wee bit more detail, and we would like to hear your thoughts and your insights as we move through the presentation. So tonight we're delighted that we're using AHA slides throughout our presentation, and in order for you to join in and share your views, if you can take a screenshot of the QR code that's on the presentation, this would allow you to participate in tonight's session. And as I've said earlier, it will allow you to capture the slides. They'll remain on your phone, and it will give you the opportunity to contribute to them after tonight. Can maybe a few people try and see, can you let me know if you can? And I can see some people have already, because I can see some emojis coming up. So if you can, that's great. We'll move on, and what we would like is, some people have already got ahead of the game. So I was going to ask you, can you share where you're joining us from tonight? So we've got Glasgow, we've got Ayr, we've got Kinross so far, Perth, Helensburgh. Great. So some people clearly are able to access the technology. Is there anyone who's having difficulty with that?
Hi, sorry. So it's Monica here. I'm just obviously watching it on my mobile, so I can screen grab it, but I can't scan the code from the thing that I am watching it on, if you know what I mean. So I would need to send the screen grab picture to my laptop later and then scan it. Do you get what I'm saying?
Yeah.
So
No,
as long as that's
absolutely.
okay, as long as I can then use this screenshot from my phone, I'll send it to another device and then I'll scan it on my phone and then take it from there, as long as that's okay.
Well, that's absolutely perfect. And if there's anything that comes
I'm
up that
having
you think,
bother putting it on.
oh, I was just going to say if there was anything you could add it into the chat.
Yeah, thanks.
If you want to answer the questions as we go
that's
along.
fine.
That should work, shouldn't it, Kelly?
Yeah, I was just going to come in there, Audrey. I wonder if you could help us. You might be able to access the AHA slides while we're doing the presentation and get the link for the presentation and maybe pop it in the chat. And if we're not able to do that for you just now, we will make sure you get a link to these slides sent to you. So if there's anything that you want to add, you will have time to do that even after the presentation. So we'll certainly make sure we get a link to you.
Thank you.
Kelly. Sorry, Kelly, it's Susanna here. Just
Hi,
to say
Susanna.
the meeting chat is turned off at present for the meeting.
Oh, my apologies. It would be the Q&A. It will be the Q&A that we'd be able to put that in. Thanks, Suzanne.
That's great. Thank you to all those who've been able to contribute so far. And we're delighted that so many people have already shared their feedback with us. And we really do welcome your thoughts tonight on a number of areas. What I would say is the AHA slides are anonymous. So please feel free to share your views. Your name will not come up on the screen or on the slides. So please feel free to share your views. Do you want to move on, Kelly?
Yep. But isn't this wonderful? Like how many people we have from all across the country with us tonight. It's great to see.
Absolutely.
Sorry, excuse me. I had raised my hand, but nobody saw it. The Q&A is not working, and when I try and screenshot your whatever that thing's called again, that barcode thing, I'm using hotspot just now because I'm not in the house. It just cuts out the hotspot. So I've rejoined this meeting about 5 times now. So, and I can't give you an answer because the Q&A isn't seem to be working on my laptop in the car.
Okay. The Q&A does seem to be open. There's a few people on it and it might be your connectivity. So what we'll do is we'll make sure the link goes out, and I can see that Audrey's also put the link into the chat for those, not the chat, apologies, the Q&A for those of you that can access it. But we will follow up with a link to it as well. So if apologies you're not able to interact with us live tonight, but you'll certainly be able to feedback.
Okay, it just says Q&A is not available for this event when I click on the Q&A. That's what it's coming up with.
Okay.
Hi,
so
can I just say, sorry, Q&A also isn't working for me. Hello. Sorry, for anybody that's having bother, can you minimise this screen that you're looking at and go into your Google and put in the code ahaslides.com and the code after that, you'll be able to get into it. You don't need to do the QR code.
I'm not sure who's sharing that, but that sounds like good advice.
Good.
Thank you
Sorry,
very
that
much.
was me. I'm Jerry. I know
you,
I'm
Jerry.
technically minded. Sorry, I'm trying to help out.
Thank you.
That's great. Thank you, everybody.
Great.
Okay.
So the next question we were going to ask was, have you explored the framework yet? So we recognise that everyone is at different stages, and there's no right or wrong answer to this. We recognise that everyone is busy. We're all busy people. We've all got our day job to do. And for some people, the time to start using this framework will be September. But for others, we know that some people have started to engage with it. But I think one of the things that, just to highlight, it will be important to note that from September, this will be the only framework that the Care Inspectorate and HMI will be using. There'll be no quality framework or how good is our early learning childcare. So from September, this will be the one framework that we are both using. So just to keep that in mind. But thank you for your honesty and letting us know that, you know, some people, as we can see, have already engaged with it and some people haven't. And as we say, everybody is on a different point in this journey. But thank you for sharing that with us. So Kelly, can we move on? Thank you. So this next part is just a wee framework update, just to let you know where we've come from. So going back to September last year was when we started to create the digital framework. It was designed, and we engaged with our members of our external reference group, and SCMA are part of that group. We invited some of our members to use or test the framework, and that was undertaken in October 2024. And following that, we did make some changes to the framework before it was then released. There was simple things that we were able to hear, like certain, if they clicked on certain elements of it, it didn't move, or certain words didn't seem right on the digital framework. So we were able to undertake the changes before we moved on. In November, we held 11 online engagement sessions, and that was really to update the sector on the progress. And we were absolutely delighted at the numbers of people that joined us. And then we released the digital framework in January 2025, the 14th of January to be exact, and it's imprinted in Audrey and Kelly and I's mind, because that's a day that we were really proud that we actually managed to release it. And then we moved on to piloting the framework's quality indicators, and that really took place across February, March, and part of April. So during the pilot, we carried out 69 visits, with a few settings withdrawn just due to individual circumstances. And during our visits, the Care Inspectorate carried out an inspection, and they had a published report with no published evaluations at the end of it. And from ourselves in HMI, we carried out some visits with just a focus on a single quality indicator, and we didn't publish a report. However, the settings that we visited are receiving a summary of our discussions. During our shared pilot inspection visits, we trialled all the quality indicators from the new framework. We used a range of different models, including having a quality indicator from every column. We had one full column each, and we also offered some settings the option to choose their own quality indicator, and that the feedback from that was really positive. We're still gathering information from all the settings through the Microsoft Forms and focus groups to enable us to learn from the pilot. So we also then moved on to having further engagement sessions in February and March to discuss the framework and the current inspection methodology. And following that, we are planning some self-evaluation sessions. Some of you may have already signed up for them, so that's the 27th and the 28th of May. We will be having inspector training, and we'll be having further engagement sessions with yourselves nearer September. So Education Scotland and the Care Inspectorate methodology will, as we've said, incorporate the quality improvement framework from September 2025. So that will be the implementation date for it. So Kelly, can we move on, please? Thank you. And this is just a slide which really highlights the pilot, as I was just talking about. So we did test the different models. We were available to answer questions from those that have been selected, and we were actually really so delighted at the numbers of people who put themselves forward for the pilots. We asked during the sessions in November if anyone was willing to have us, and we had over 256 people who put their names forward and asked us to come and visit them as part of the pilot. So as I've said, we're still gathering that feedback from the pilot through for Microsoft Forms and thematic groups, and we will be analysing of it all to gather that kind of high level messages, and that will help inform our future activities, including the methodology, which is something which lots of people are interested to know about. So can we move on, Kelly? So since the release of the framework, we've listened to feedback, and we've tried where possible to develop solutions to the asks. So the visual on this slide, this was created in response to requests for an overarching visual, which clearly highlighted the quality indicators and where they sit under each heading. And you'll see, like, we have the following headings. We've got leadership, we've got children thrive and develop in quality spaces, we've got children play and learn, and children are supported to achieve. And this visual can be found on the frequently asked questions document, which we continue to update. That's at this moment in time sits on the Care Inspectorate's website. If you go into the framework, which sits on the Education Scotland website, you'll see there's a link, and Kelly will show you that as we move through. You'll see there's a link. You can click on the link and it will take you to the frequently asked questions, where this visual and other visuals that I'm about to show you are there. So there's the visual for childminding quality indicators. We recognise that there's been an ask for numbers on the quality indicators. However, we've been guided by our web content team in terms of accessibility. And also we would like everyone to focus on the language of the quality indicators. You know, for example, we have the leadership and management, you have the staff skills, knowledge, values. So we would like people to focus on leadership instead of talking about 1.1 or 1.3. And also we've been advised that in terms of search engines, if you search for the framework and search for leadership, then this will come up. But if you search for 1.1, 1.2, then it's not as easily accessible. So we've had some further feedback on this, and we're still taking that on board as we work with the web content team moving forwards to September. So if we can move on to the next slide, Kelly, and again, school-age childcare quality indicators, and you'll see clearly the headings. And in terms of the sector-specific quality indicators, there are some slight differences in terms of the language we used, and that's because we worked, as I've said, closely with colleagues in SCMA and SOSCN to develop certain parts of the framework to ensure that it met their members' needs. So I'm now going to pass you on to Kelly for the next part of the presentation.
Good evening, everybody. A very warm hello to everyone, and as has been said, thank you very much, all of you, for joining us tonight. We know how busy you are and that almost everyone on this call will have been working through the day today, looking after children and caring for children. So really appreciate you being here with us tonight. I'm going to start us off with having a look actually at the framework. We appreciate how busy people are, and we're not surprised by the numbers of people that just have not had that opportunity to go into the framework yet and have an explore of it for lots of different reasons. And so when we were developing the content for our engagement sessions, we were thinking really hard about what would be the most value at this point on the journey. And at this point, because Trish has highlighted as well, we're still doing some refinement of the framework. What we felt was at this point, we just want to make the framework seem manageable to people and not seem like something that's really scary that's coming in September. So hopefully that's what we're able to do tonight. So what I'm going to do now is switch over to the framework, and hopefully technology all works for me and everybody can give me a thumbs up if they can see.
Sorry,
Yes.
Kelly, can I just interrupt you and just check that everybody can see that the Q&A function is now open, so you can pop your questions in there. And can people see the Q&A? Oh, it's Mackenzie. I think you get your hand up. Yeah.
Sorry, I was trying to put a light thing that I could see that, but no, I can't see the Q&A. I've been looking for it.
Right. So it's along beside the chat function along the top. You should be able to see this chat and a Q&A function where you would also raise your hand and react and things. So it should be visible for you.
No, it's
It
not.
says
No.
not available for this event. It's still not available.
Okay, right.
Audrey, let me go and have a look and I'll get back to you. Shall I again?
Okay, thank you. Sorry, Kelly.
Okay. No worries. We'll keep working on it in the background, everyone, so that there's a space there that you can put your questions into for later on in the session. So hopefully we're able to get that working for you. Okay, but hello. Hi.
So sorry. I'm so sorry. It's Monica.
It's
It's
all
just to because obviously there's a wee struggle with this. I personally, when I press the Q&A, it also says it's not available. However, it does then say underneath it, turn it on in your meeting options. So it sounds like it sounds like I need to, as a user, have to go and switch on that function within my own meeting options. Just if that further informs, because when I know how to use these things. So when I pressed the Q&A, I was expecting to see it, and it does say it's not available for this event, but as I say underneath, turn it on in your meeting options, which I personally don't know how to do, but I'm not that worried. It's just if that helps inform the kind of the confusion here that it might be that we've got to individually go and switch it on in our own devices meeting options. I don't know if that sounds plausible.
It might very well be, and I'm thinking, Monica, you'll need to come to some more of our online sessions for that technical support. It's a great help. What we'll do is, like, even if we don't get the Q&A function operating so that people can put their questions into the chat, we are definitely going to give you space for some raised hands at the end to ask a couple of questions.
Just if
we
that
can
helps.
do that too.
I don't think it's you. I think it's possibly us individually all have to allow it to function. I don't know, but that's what mine is saying anyway.
Sometimes that can happen, and it can be down to the different devices that people will be on as well.
Yeah.
Okay.
No bother. Right, thanks.
So I know there's a few hands up just now. I'm keen to start going on, but we'll take a couple of those hands that are up just now in case there's anything quite pressing that anybody needs to share. I think it's Tracy and Mags. Or are they legacy hands?
Yeah, it was just to say the Q&A is doing the same. It just says not available. So I think, as that lady just said, it might be our settings. I've not come across this before. Normally it's always there, but it's not a problem. It's fine.
Apologies, everybody.
I just can't find it either.
All right, okay, thank you.
Right, okay, but I'm still sitting listening and waiting on my dinner arriving.
Oh, if that's Tracy or Mags, that sounds ideal. That is ideal. No, apologies that's not working for us, but as I say, we'll make sure there's some space for people to raise some hands and ask some questions when we get to the end. Okay, so let's do a bit of a deep dive into the framework. What you should be seeing on your screens, hopefully, is what we refer to as the landing page for the framework. So I have the framework starred because I go into it quite regularly, and you might want to do that just so that it's always on there for your own computer system or however you'll access it. But this is the landing page. And on the landing page, there is some general information about the framework. So it will give you information like the headings that Tricia talked about earlier: leadership, children thrive and develop in quality spaces, children play and learn, children are supported to achieve. Okay, those headings are the same regardless of which sector you're from and which section of the framework you will be using. If you scroll down, there's some additional information, and these can be expanded. And when you go into these give you some additional information. So for instance, the principles of the framework. Underpinning the framework is our children's rights and approaches such as the promise that we've made to Scotland's children. So that's just us telling you how we've weaved some of that into the framework and demonstrating that it's been considered. There's some information about self-evaluation. There's some information about the roles and responsibilities about the different inspectorates. And then we have down at the bottom here the grading criteria and the frequently asked questions that Tricia mentioned earlier. So I will go into the frequently asked questions and just go into the hyperlink that's there. And I'm taking you there so that you can see, if you scroll down, the tables that Tricia showed earlier. And obviously the significant table for us to have a look at tonight would be the childminding table. And I'm showing you that because we understand that the framework can feel huge, it can feel big, but when you see the structure of the framework on a table, it might make it more manageable in terms of thinking about how you'll approach it. You're much more likely to have a look at that and think, right, actually, I'm going to start off with play and learning, and that's the section of the framework I'm going to look at. Okay, so I'm just going to take myself back into the framework.
Kelly, see, while you're going back, just say that the chat function's opened. Vanessa's opened it, so people are able to put questions and, thumbs up, emojis, etc. in the chat. So that's now opened.
Oh, brilliant. Thank you so much. Okay, so at the bottom of the landing page, what you'll see is what we're referring to as tiles. So one of the biggest achievements of this framework is that we have created sector-specific aspects of it. We have one for early learning and childcare. And what we mean by that is all other settings other than a childminder and a school-age childcare setting. We have a specific section of the framework for childminders to reflect the uniqueness of that role. And we have one for school-age childcare. And when we're talking about school-age childcare, we absolutely understand that some of you only provide care to children of a school age, but we would still say that we would be encouraging you to use the childminding section of the framework for your self-evaluation. And the reason for that is across all three of these, there are many, many similarities because good quality care is good quality care. However, we've worked really hard, and as Tricia said, with representatives from each of the sectors to make sure that we've captured the nuanced differences about each of your sector types as well. So if you are a childminder, you would go into the childminding section of the framework. Once you're in that section of the framework, you're again on a landing page. And this just gives you that general information, some of which I just shared with you there around if you're a childminder, this is the section of the framework you would use. Even if you're delivering ELC funded provision for children in your care, we still consider this to be a comprehensive section of the framework which should support your self-evaluation, and this is where you can go. By all means, if you wanted to look in other sections of the framework, you're welcome to do so, but the expectation is that we would only be inspecting the quality indicators within this section of the framework and would consider this to be a supportive self-evaluation tool. So on the landing page, you will have again those headings. So leadership, children thrive and develop in quality spaces, children play and learn, and children are supported to achieve. Underneath the headings, what we have is the quality indicators that make up those headings. And these are underneath here. And you can also see them listed down here. And what you can see there is there are 6 quality indicators for childminders. And what we're going to do tonight is go into the safeguarding and child protection quality indicator and have a wee explore of it. and we go. So when I click onto that, we can go into the quality indicator for safeguarding and child protection. Every quality indicator follows the same format. So when you go into the quality indicator, you will find very similar layout to that quality indicator, and that's a consistency to make it manageable for you. But obviously the content of each one is themed around the quality indicator. There are also themes in each quality indicator that breaks it down a wee bit more into manageable chunks for your self-evaluation. And if we consider the specific one that we're in, which is safeguarding and child protection, you can see here the themes within that quality indicator are arrangements for safeguarding, including child protection. So that's that consideration of how we keep children safe and those formal processes around acting to protect children when we think they're at risk of harm. We have a theme around children are safe, secure and protected from harm, and then the theme around national guidance and legislation. Every quality indicator has a descriptor about that quality indicator, just giving you a little bit more information about what we mean about those themes. And then at the bottom, there is further information to support your self-evaluation. So these all can be opened up. And within each of these, we have provided an illustration of what would reflect either very good practice or weak practice. Okay. And that's just to help people think about where they are in terms of their improvement journey so that they can benchmark and have a reflection about some of what they've got in place and maybe some aspects that they don't. What we would always say with that is that these are illustrations, they're examples to help people and support people on the improvement journey. It's not a checklist to go through. It doesn't give you examples of every single thing you might do because you actually might go above and beyond this. It's just an illustration. And if we're looking at safeguarding, including child protection, what we're talking about there is just that as a childminder that you have up-to-date policies and procedures and that your policies and procedures reflect your setting and your area. So for example, your policy and procedure would guide you to the specific arrangements for reporting any concerns that you have for a child in your particular local area. There is an illustration that talks about the partnerships that you might have. So we know that to keep children safe and protected, that good communication is absolutely important. So that's those partnerships with the school. It might be a partnership with the local early learning and childcare setting, providing daycare for children. It might be actually you have links with the health visiting team. Those partnerships will vary, but it's asking you to start to consider those and think about that in terms of protecting children. And then, of course, there is the consideration around your training needs and professional learning and what you're doing to keep yourself up to date about that level of practice. And we also reflect that you might possibly have an assistant as part of your service. So it's asking you to think about your professional learning and their professional learning as well. And then there is an illustration of where the practice might be considered weak. And that's where there is just not an understanding of the policies and procedures in place or the responsibilities that an individual might have and not recognising the need to and engage in any learning or training or reading to keep up that professional learning in the area of protection and safeguarding. And you'll see similar in the other two themes as well. And that's just to give you a guide around some of what you could be doing or just give you that reassurance that you're on the right track if you're reading that and thinking, yep, that's absolutely, I can see myself in that illustration. At the very bottom, we also have provided challenge questions that Tricia discussed as well. So you will see some challenge questions there, very much related to the illustrations, just asking you to think about your policies and your procedures, your relationships with key partners, the families that you work with and children. And they're just to prompt and get you thinking. And again, you might have some questions, self-evaluation questions that you ask yourself or that you use from other tools or other training. That's just a list of some of the ones that we consider to be quite important and valuable to help you. But again, not an exact list. There are more that you might use from other tools. So with consideration of the questions and what I had talked about earlier around the nuanced differences between the between the three sections of the framework, what I'm going to do is just pop back up to the top and do it slowly so I'm not making everybody dizzy as I dive around the framework. What you will see at the top of the framework here as well is there are direct links into the other sections. So you can move into the school age childcare quality indicator of safeguarding and child protection with ease, or you can move into the early learning and childcare one should you wish to. The only reason I'm going into that is because I would just want to draw your attention to some of the differences that we refer to. So if I look at the challenge questions for early learning and childcare, there are challenge questions that ask you about the, and I may have discovered that one of our links, I have discovered live that one of our links is not working. It's taking me back into the childminding one. So that's good that we're doing this, because then we can pick that up and get that fixed. I'll go into the school age childcare and go down into school age childcare. And you will see that there are some differences around the questions that we're asking you as well. So the first question is there an appropriate designated person in place for child protection? So we're not asking that of childminders, because often the childminder is that person that leads child protection in the setting, whereas in a school age childcare setting or a daycare setting, we were talking about larger volumes of children and staff teams. We would be asking people to think about who's going to lead child protection there. So you can see why those questions are slightly different. Okay, and at the side here, what you'll see, this is the link that you can use to download the framework if you choose to, if you prefer to use this as a PDF version. Okay, so we will come back into the slides. Bit of a whistle-stop tour of the framework. What we would ask you to do now, those of you that have links to the AHA slides, and people have started, so you get ahead for us, is thinking about the layout of that quality indicator. So thinking about the fact that there is some general information, there are some themes, there are illustrations, and there are challenge questions. What's your initial thoughts about the layout of the quality indicator? So people are thinking it's more simple. Good. Very clear. Okay, that's helpful. That's really reassuring, because that's all the things that we wanted it to be. We wanted to streamline things so that it was easier for people to use. Okay, fantastic. So I'm going to let you all continue to keep adding to that, and just to let you know, we hold all of this and really use this as your feedback live for us. So really appreciate it. Thank you very much. And then I have another question, and people are starting to answer that as well. So thinking about then the framework as a self-evaluation tool, do you think that quality indicator would have supported you to reflect on your practice, evaluate it, and start to think about anything you would do? And so some people are undecided, and of course some are undecided. We've got people on the call tonight that are thinking that this might have been the first dive into the framework, and actually you just want to test it, and that's when you'll be able to make those decisions. And again, with some of the maybes, but some of you are already beginning to think that you could see yourself using this as a self-evaluation tool and that it would support you. Thank you very much. Okay. So, as we have said, there is a link in the Q&A to the AHA slides if you weren't able to get the photographs. Even after the session, you're able to go back in and answer some of the questions. If you're a bit like me, I like to think about things. There's still options for you to come back in and answer later. So don't worry if you're not getting a chance to contribute just now. We're going to shift things a little bit, okay? And we're going to start to think about methodology. And what we're going to invite you to do just now is have a think about your inspection experiences. And when we're asking you about your inspection experiences, we really want you to think about the way in which the inspection was undertaken and the things that the inspector did, as opposed to the outcome of the inspection. And the reason we're saying that is quite often people will want to talk to us about the individual outcome of their inspection, but myself, Audrey and Trisha are unlikely to be able to answer those questions because we're unlikely to have been part of the inspection that you're referring to. But what we're asking you to think about is inspection methodology. So what am I talking about when I say inspection methodology? Think about your experience in the inspection, okay? So what happened at the start of before the inspection, the information that we asked you for, who we asked you to get information for. So some of you will have had paper questionnaires have gone out. Some of you might have had recent inspections and so have had the MS forms. So was that helpful? And then start to think about the inspection itself. So when we were in your setting, in your home and in your service, did we spend time observing children, and was that helpful? And did we ask to look at some records that you might hold? Were you aware of the grading criteria? Is the grading criteria helpful so that you can begin to think about where you are, and is supporting you in those conversations that we have with you about where we are evaluating practice? Are you aware of some of the standards that we already use to support our evaluations? So, for example, we use the health and social care standards, and we very much use them as part of our methodology to make sure that there's a transparency and that everybody has that opportunity to know what's expected of them. So thinking about those experiences. And then, of course, we produce reports. Does that help your improvement journey? Are the reports big enough? Are they saying the things that you need them to be saying? What bits about the inspection methodology that we use to come to our conclusions works for you? What really supports your improvement journey? But we're at a period of time where we're beginning to think about, we're asking that because we're at a period of time where we're beginning to think about our inspection methodology and moving forward, as Trisha has said, when we begin to implement the framework into our inspection processes come September. So we're also asking you for your views on if we could make something better, what would that be? So the two questions are, what works really well and what would you just want to make sure that we kept? What really helps support your improvement journey? And if you could make something a wee bit better, what would it be? And share that with us. Okay, some of you may have already started with this, yeah. So I'm not going to be able to read all of these. As I mentioned earlier, we're gathering all of this. This is very much us listening to you and hearing about your experiences of inspection. And we're putting all of this together and we'll do some analysis and we'll see what's emerging commonly across all of the sessions that we've done. So people are talking about questionnaires for parents. That's something that you value. And that's great, and I can absolutely see why, because parents' views are just absolutely so crucial and important. Spending time talking with children and playing with them. Positive feedback, less focus on negativity. So looking for a strength-based approach, and sometimes, you know, obviously we will have to talk about areas that need to be developed in terms of practice, but always trying to take a strength-based approach there as well, and building on what's working well. Okay, support from inspectors was very good. Not wanting to let me scroll down. Okay, spending time with children. Okay, and then I will move on because I'm conscious of time. And we're talking about having maybe a second layer and third layer that links the latest best guidance, essential training to each quality indicator. That's a really, really good point, actually. And it's one of the things that we're hoping to do, if I'm understanding that right, is that and actually the child protection and safeguarding quality indicator doesn't really strongly link, it doesn't strongly illustrate that, but we are going to be putting links into the framework for best practice. So for instance, if you go into the nurturing, care and support quality indicator, there is a link in that quality indicator to the mealtimes practice note. There's a link to safe sleeping. So when we're talking about that within the quality indicator, we're very much trying to link that to best practice. And the reason we're doing it that way is just because we want the framework to be manageable. So we don't want the framework to become so big that it's not possible to read and get through, but we are putting the links on it. So if you happen to be developing that bit of practice, you know where to go to do a bit of further reading. So very much considering that just now. And I think one of the benefits of the framework being digital is the vision that we'll be able to even weave in some illustrations of practice and continue to make the framework dynamic and responsive as well. Okay, and someone said just to make the inspections less scary, and we absolutely understand that you can have the nicest inspector on the planet that's come to do your inspection, but it's still an inspection and it can still be really, really stressful. And we do try our best to alleviate that stress. And actually, that's been a bit of a focus area of practice for the care inspectorate inspectors over the last year. We've been really exploring our professional impact and thinking about that. So very much having those questions, those reflections as inspector, these are ongoing. And thinking about the grading criteria is very personal to inspectors. So every inspector wants different things. So we do often hear about consistency, because I think that's what that's talking about there on these sessions, and hopefully the slide on methodology offers some reassurance, because what is consistent, should be consistent in each inspection, is the approach that the inspectors take. So every inspector might not all inspectors would necessarily look at the exact same policies or records when they're out with you, but they should look at some, and that's often led by the uniqueness of your service, of what they would sample. So that's why that can be different, but it's the fact that they would ask for that sample after observing some practice. So just a huge thank you, everyone, for your contribution so far. As I say, we are very much gathering these, and there'll be some time spent analysing these. And we were doing a session earlier on in the week, and I made the joke, I always manage to squeeze one of my children into one of the slides. So this is Isla, everybody. Before we go on to answer some questions, just want to leave you with a couple of thoughts, is that hopefully what you've got tonight is a sense that the framework is approachable, and that actually we hope that people might come away tonight and go, I'm going to pick a quality indicator, not feeling that you have to have that time to read it cover to cover, that actually make it manageable steps for yourself. Even go into something that you're familiar with and you think you're really good at, and pick up that quality indicator and have a wee explore about it. And just that we recognise that this is change, and change can be a bit scary and feel a bit uncomfortable, but actually that's okay to feel like that, and actually that we all can feel a bit like that, and it's just about taking that courageous step, picking up a QI and having a wee explore of it. So there are a few more questions that we would ask you just to answer, but I'll let you do that in your own time, and those questions are just around the session. And we're asking if you are feeling more confident about the framework tonight. We're not asking you if you are confident about the framework. We wouldn't expect people to be feeling confident about the framework at this point. We know there's a bit of a journey in that it'll be breaking it down and exploring it in chunks. But if you could just let us know if you're feeling a wee bit more confident after the session tonight, and anything else that would be of value to do going forward.